I want to tell you what led to Palm Health. Hello, I'm Shane Grindle. Let me know if this sounds familiar. My professional journey began with a profound sense of purpose. I was at the Mayo Clinic, a place I was deeply committed to, immersed in the complexities of cardiac transplant procedures. I had an unwavering dedication to my patients and a genuine love for medicine. But even in that environment, the subtle seeds of burnout were sown, a testament to the inherent pressures of the traditional healthcare system. I then transitioned to primary care, hoping for a change of pace. Paradoxically, I found myself battling a lack of support, insurance red tape, and short visit times that left me feeling rushed and disconnected from my patients. The constant battle against a system seemingly designed to hinder rather than help patient care began to overshadow the joy I once found in healing. This growing frustration and fatigue would eventually lead to a personal and professional crisis. The breaking point, from despair to a spark of rebellion. The pressures intensified dramatically during the peak of the coronavirus pandemic. I was working in correctional medicine at the heart of the crisis, and it took a severe toll on me. This period manifested as physical and emotional strain, including a significant 40-pound weight gain and persistent fatigue 10. But the symbolic breaking point came when my employer abruptly and unexpectedly removed my company vehicle, leaving me feeling stranded and abandoned by the system I had served so faithfully. In that moment of profound despair, a spark of rebellion ignited within me. I had a pivotal realization. I no longer had to be a pawn in this flawed system and could, in fact, create my own path. This personal crisis became my professional mission for systemic change. The Medpreneur solution introducing direct primary care. That pivotal realization propelled me to establish my own direct primary care practice. This is where the Medpreneur mindset comes in, blending the art of healing with the science of business. The core of this transformative approach is the direct primary care DPC model, which is a fundamental shift away from conventional insurance-driven models. With DPC, patients pay a predictable monthly fee directly to their clinician for a comprehensive range of primary care services. This fosters deeper, more meaningful patient-provider relationships and promotes transparent, affordable care by bypassing traditional third-party intermediaries. It's a key distinction from concierge medicine, as DPC is designed to be a more affordable and accessible alternative for comprehensive primary care, not a luxury. Palm Health's uniqueness: technology as a human connection enabler. At Palm Health, we're not just practicing DPC. We are positioning ourselves as the future of primary care in Jacksonville. We're Florida's first AI-first clinic, and that distinction is crucial. Our mission is not to replace human doctors with technology, but to leverage AI as a powerful enabler for enhanced diagnostics, streamlined workflows, and more personalized patient engagement. Think of it like this: your personal healthcare is no longer reactive, it's proactive. We're a team of highly trained specialists, and technology is our powerful ally, just like the Avengers. We use the Butterfly IQ ultrasound device, which is an ultrasound on a chip system that fits in the palm of your hand. It's like having a tricorder from Star Trek, an advanced diagnostic tool that enables us to perform bedside diagnosis. This one device can perform abdominal, cardiac, vascular, and musculoskeletal scans with unprecedented versatility. This capability democratizes advanced imaging, bringing diagnostic power directly to the point of care. This reduces your reliance on expensive centralized imaging centers, directly addressing the expensive and impersonal criticisms of traditional healthcare. We also use the EcoA eye-powered stethoscope. This isn't your grandfather's stethoscope. This innovative device uses AI algorithms for highly accurate detection of critical cardiac conditions such as reduced ejection fraction EF, with an area under the curve of 0.85, a sensitivity of 77.5%, and a specificity of 78.3%. It can identify subtle cardiac signals that would typically be undetectable, to a physician using a traditional stethoscope, offering a first-of-its-kind, 15-second non-invasive early detection test for a weak heart pump. For documentation, we use AI scribes like Heidi Health to automate clinical documentation. This directly addresses one of the primary drivers of clinician burnout, the overwhelming administrative burden and insurance red tape. By automating these tasks, it frees up valuable clinician time, allowing us to have longer, more focused patient interactions. Finally, we use Gemini AI for intelligent decision support. This tool processes and analyzes large data sets, identifying intricate patterns that may be invisible to human clinicians. This capability significantly enhances diagnostic accuracy and allows us to provide real-time, evidence-based recommendations, empowering us to make more informed decisions and ultimately lead to improved patient outcomes. Its ability to predict disease progression is particularly crucial for individuals who might state, "I feel fine, I don't need healthcare," as it demonstrates the continuous value of intelligent health monitoring and preventive intervention. Never worry about your protected health information, as everything is HIPAA and GDPR compliant and safe. Partnering with small businesses for a healthier workforce. This model isn't just about individual patient care. It's a strategic solution for small business owners in Northeast Florida. Employee health is one of the ways we serve our community and our commitment to improving Jacksonville's health. Many business owners believe they can't afford to offer health benefits, and they're also confused about how to manage them. But the reality is the hidden cost of high employee turnover can range from half to 4 times an employee's annual salary. You can partner with us to provide a comprehensive and transparent healthcare benefit that directly leads to happier, more productive employees. By doing so, you're not just a business owner, you're an innovator. You're an employer who understands that a proactive approach to employee wellness is a strategic investment in the long-term health of your company. Palm Health can act as your dedicated HR partner for employee wellness, helping with everything from onboarding to hosting health events. This level of support reduces administrative burden and shows a commitment to employee well-being, which helps with retention. Our model's predictable revenue stream and the removal of third-party billing significantly reduce administrative tasks and overhead costs, often by more than 40%. We want to make it easier to support small businesses in doing the right thing for their team. Conclusion: the journey of a medpreneur is about more than just starting a business. It's about a profound contribution to systemic healthcare transformation. My journey from burnout to breakthrough underscores the transformative power of agency, and that liberation from systemic constraints is not only possible, but necessary for impactful patient care. I believe we can reshape healthcare into a system that is more equitable, efficient, and profoundly human. This is our mission, and I'm inviting you to be a part of it. To learn more about our patient-centered approach or how we can partner with your business, please visit our website and subscribe to our channels. Join us in charting a future where healthcare truly serves its purpose to heal and empower one person at a time.